As we reported, President Donald Trump signed a largely symbolic executive order Friday, stripping federal funding from schools that require students to be vaccinated against COVID-19. The order directs the Departments of Education and Health and Human Services to essentially create a plan to eliminate completely COVID-19 vaccine requirements in schools. Now, to be clear, this order only applies to COVID-19 vaccine mandates. Schools that require immunization for other diseases, things like measles, polio, and chickenpox, will not be faulted. Dr. Amesh Adalja joins me now. He is an infectious disease physician and senior scholar at Johns Hopkins Center for Health Security. Thank you so much for being with us. I want to start with asking, in your assessment, is COVID-19 still a threat in schools? Do you think these mandates are still necessary?
Well, the important thing to know is that there are no mandates. If you look at all the public school districts across the United States, zero have a vaccine requirement for entry. So this is a little bit of theater. But I do think it is important for children to be vaccinated against COVID-19 as part of their routine childhood immunization. And I think it's fine for schools to require that as a condition of enrollment. But I think you can only look at this executive order as basically just pandering to the anti-vaccine movement and really with no impact because, again, it does not apply to any school district in this country.
So do you think it could reach into some of the other diseases, things like measles, polio, and chickenpox, immunizations for those diseases?
I hope not, but certainly with RFK Jr. now, the Secretary of Health and Human Services, there is this energy in the anti-vaccine movement to go after school requirements. So I would not be surprised to see them attack other vaccines, ones that are tried and true that really keep our schools operating and keep our schools safe, especially in the midst of an outbreak in Texas that we see in a school that's has very low vaccination rates. So this is a fear that we have, that this anti-vaccine sentiment is going to bleed from COVID-19 to other routine childhood immunizations and make the country a lot less safe when it comes to vaccine preventable diseases.
Also want to get your take on the country's new health secretary, Robert F. Kennedy Jr. How is the medical community responding to this pick? And what do you think we can expect from his leadership?
I can't speak for everybody else, but from my perspective, this is a disaster. This is a catastrophic appointment. This is the exact worst person to be in this position. Somebody who wants to take a pause on infectious disease in the midst of an avian influenza emergency that we're dealing with. Someone who does not believe in the germ theory of disease, does not believe HIV causes AIDS, advocates drinking raw milk, has really assailed vaccines for decades, wants to create a statue to Andrew Wakefield. This is basically a nihilist, a destroyer that's bent on destroying or evading the value of one of humankind's greatest innovations, vaccines. So I think this is this can't be looked at anything less than cataclysmic. And I think the executive order and RFK Jr.'s appointment are evidence that Donald Trump believes he has to pander to this anti-vaccine group, this dark ages primitive group that wants to allow diseases to spread.
Okay, we appreciate your perspective on the issue. Dr. Amesh Adalja, thank you.
Thanks for having me.